How is palpation performed during a clinical breast exam? Imagine feeling 4 clues hidden beneath the surface of the breast to catch any early signs of trouble. During a clinical breast exam, palpation is a key technique used by healthcare professionals to find lumps, thickening, or other unusual changes in breast tissue. The process starts with the patient lying comfortably on their back, which helps flatten the breast against the chest wall. Usually, the arm on the side being examined is raised above the head or placed behind the neck. This position makes it easier to access all parts of the breast and helps the tissue lie flat for thorough examination. The healthcare provider might start with the unaffected breast to compare how it feels and then move to the side with symptoms or concerns. Palpation is performed using the pads of the middle 3 fingers, which include the index, middle, and ring fingers. These pads are more sensitive than the fingertips alone and allow the examiner to detect even small lumps or irregularities. The fingers are held in a slightly cupped position, ready to gently but firmly press into the breast tissue. The pressure should be steady, enough to feel through the layers of tissue down to the chest wall, but not so hard as to cause discomfort. Circular motions are often used to systematically compress the tissue, ensuring no area is missed. To cover the entire breast thoroughly, the examiner uses a systematic approach. One common method is the vertical strip or lawnmower technique, where the fingers move up and down in straight lines across the breast. This pattern helps ensure all tissue is examined from the collarbone to the rib cage and from the armpit to the cleavage. Another approach is the radial or spoke method, starting at the nipple and radiating outward like spokes on a wheel. Some clinicians prefer the concentric circles method, beginning at the nipple and moving outward in circles. The breast can also be divided into sections like a clock face or into quadrants, with each section carefully examined. During palpation, special attention is given to the forequadrants of the breast and the tail of Spence, which extends toward the armpit. The nipple and areola are gently compressed to check for lumps, thickening, or any abnormal discharge. If a lump is found, the examiner notes its location, often using the clock face or quadrant system, along with its size, shape, consistency, mobility, and tenderness. The skin over the area is also checked for any changes such as redness or dimpling. The exam also includes feeling the nearby lymph nodes, especially in the underarm or axillary region, as well as the supraclavicular and infraclavicular nodes. Enlarged or tender lymph nodes can sometimes indicate the spread of disease. If tenderness is present, the examiner might start on the opposite side to avoid causing discomfort early in the exam. Overall, palpation during a clinical breast exam is a careful, methodical process that uses gentle but firm pressure with the finger pads, moving systematically over all breast tissue and regional lymph nodes. This technique helps detect early signs of breast abnormalities, supporting efforts for prevention and early detection. Remember, each person's body is unique, so if anything unusual is found or if there are concerns, it's important to consult a healthcare professional for personalized advice and further evaluation.